then I am going to turn things over to Sheryl and look forward to learning with you. So without further ado, let me just make you the host, Sheryl. And
Great.
all right.
Thank you. So this is Sheryl. Just a couple of quick housekeeping things. With my learning disabilities, I'm not able to use all the features of Zoom. So if you are wanting to ask a question, if you put it in the chat, Rabbi Kaplowitz is going to help me to to read those out so that I know that's there. And I also can't see if you make like reactions or whatever the feature is on here. So if that happens, I'm going to ask Rabbi Kaplowitz to help with that. And when I share my screen, I won't be able to see a raised hand. So Rabbi Kaplowitz, if you can help with that also, that would be helpful. I'm going to ask that people keep on mute just so that we keep noise level down, unless we haven't captured a hand, and then unmute and just ask to speak. So I'm going to go ahead and share my screen. Okay. All right. I'm assuming that we've got that up. All right. So as Rabbi Kaplowitz just said, February is Jewish Disability Awareness and Inclusion Month. But for me, it's just a few days that we can sort of all pay attention to things that we may have forgotten in the past. Kind of like how Yom Kippur is one day to focus on our tshuva, but really we do it all day, every day. It's kind of the same thing. So without further ado, for those who don't know me well, I am the board chair for an organization called Yad HaChazakah, which is the Jewish Disability Empowerment Center. And we're based out of New York, but we serve the entire country. And even outside of the US, we have members in Israel as well. And what we do is we're set up like the secular centers for independent living. So we do all the same services, but we do it with a Torah lens. So we use the independent living philosophy, but instead of civil rights laws like the Americans with Disabilities Act, we use Torah law. When we talk about civil rights, we talk about Torah obligations. And so that's how it translates. But really our motto is using Maimonides' highest level of tzedakah. That is to help oneself, to set someone up in a job, to give someone the supports that they need in order to excel at a task themselves. So it's not doing for, it's not protection of, but rather giving ample tools so that we can do in life what we set out to do as anyone else would. So I want to jump in here since this is the Parsha Shir, just to take a little tidbit from Terumah for a second. In Terumah, we're talking about the building of the Mishkan. And the Parsha opens with the fact that the people are to give of themselves freely to this holy space, to this holy piece that is the center of our attention. And what always pulls at me on Parshas Terumah is this sense of community, this willingness to give freely in order to create something that is bigger, that is better, that is more whole, that everyone can participate in. It's not just for the self, and it's not for the glory of that self, but rather as part of this community. And at Yad HaChazakah, we really focus in on that. That's a piece of this Maimonides' highest level of tzedakah, is what we can do to participate ourselves. It's not just helping the person with the disability to achieve their highest capability, but it's also the person with the disability contributing in the way that they can to enhance the community as a whole. So with that, we all know that this past year has been really tough on all of us for a myriad of reasons. For those people with disabilities, there have been some specific areas that have been particularly difficult in ways that the average person may not realize. And Yad Chazaka has been in the trenches. My days have been incredibly long, sometimes 16 hours a day, working with folks just to stay alive. And some of these specific issue areas are the large civil rights issues, like our ability to access healthcare, our maintenance care during a time when there's a COVID surge, and people have to be prioritized in some way. If that is done based on an assumption of the worthiness of our lives, that tends to get in the way. Communication. How do people with disabilities who are deaf hear public service announcements about, what the status of COVID in the community is? Have we made sure that press conferences have ASL interpreting? Have we made sure that relevant information from shuls are captioned, are shears captioned, for example? Food. How do people access food? Food insecurity has gone up. Many of us have been involved in alleviating that in our own communities and elsewhere as the months have gone on. For folks with disabilities, this has been more challenging for the simple reason that in, let's say, the Orthodox Jewish community, a lot of food distribution has centered around the kids in schools. And so kids can continue to get meals through their schools, but they're prepared meals. So if someone has a dietary restriction, it becomes very difficult to make use of that. If someone cannot get out of their own place, like myself, due to immune system issues, how can they also be in a carpool line waiting to get their box of food? So we've had to make significant adjustments. All throughout the country, communities have been facing these challenges. We've all followed the school sagas of, do we do virtual learning or do we do in-school learning? For folks who were all of a sudden thrown into virtual learning, if they had individualized education plans, even in the public schools where federal money is taken and that's required, all of a sudden it didn't necessarily apply and there wasn't a mechanism for enforcing that. So a lot of our folks with disabilities who had specific needs were not getting that, especially at the beginning. And for some, they were getting it, but it might be that the virtual space required new and improved plans to adjust to that virtual learning, and that was really not happening. Information processing, it goes along with the communication. If things are not provided in a method that people can access things, then it makes it very difficult to be included. Some of that in a time of COVID is life-sustaining or life-saving information. A big issue for us has been the participation in several pieces of litigation for, I think we're up to 13 states now, where during the surge, during the COVID surge, people's lives were put sort of on a assumed prognosis of the ability to survive on a ventilator. And so there have been various lawsuits in various states that we've been involved with on this. Physical access. So a lot of states, when they set up contact tracing, they only set up contact tracing sites and testing sites, the actual testing sites, that were drive-through in order to go more quickly and to socially isolate folks more. But the problem with that is a lot of those were not physically accessible to a lot of people with disabilities. If you don't drive and you need to use public transit, you're exposing yourselves more to that testing site, or you may not have been allowed to be on public transit if you had symptoms. So how do you get there? How do you get access to a COVID test? If you are a passenger in a vehicle and someone else is driving, it depended on the state whether the person administering the test was allowed to reach into the vehicle due to social isolation kinds of issues of where the person is versus where their mask is, et cetera. So we've been involved in many of these issues as well. And I know I'm throwing a lot at people, so if I'm going too fast, please let me know. As we all know, disparities have come to light. I don't think that most of us would think that anything new has come to light. It's that disparities in minority communities have been heightened. Well, this has been the same for people with disabilities. Two major areas that this has highlighted for us is in congregate care settings. And nursing facilities especially, infection control has been an ongoing controversy, an ongoing battle for the last 30 years at least. And all states have the obligation to move people out of congregate care settings into the most integrated settings based on their need and their desire. But it's a constant battle whenever you have people living in close quarters, not just in nursing facilities, but we've seen in prisons and other spaces as well, that it's very hard to control infections. There are regulations, and one of the things that we've been working on is that just due to a pandemic, those federal regulations still have to be met. And for a lot of entities that seem to go by the wayside. The second piece that I've already talked about is this medical rationing. It's happening a lot with folks with Down syndrome especially, who have been seen to have a higher morbidity than the average population, and also have other conditions that make the use of a ventilator more difficult. And we've had several cases in several states where without trying that, doctors have made the decision not to try it, and thus making a medical decision that unfortunately influenced the individual's life. And so we've been working hard to protect that. Sorry, I'm going too fast here. Okay. So a peek into the trenches. Just a couple of cases that I have picked out just to highlight some of the Jewish community intersections that we've been working with. So food insecurity. Take the single mom who has multiple children in multiple schools, one male, one female, and is trying to pick up lunches for the kids while both kids are virtually learning at computers in the home. How do they do that? How do they make sure that they can put the extra food on the table at the same time that they can be supervising appropriate learning for the child? And so we've done several interventions where counties have had volunteers that have had access to PPE, which has been another issue for a lot of us in the community, where they can use that PPE, and when there's a specific time, either before the lunches go out or at the end of that run, that they can go to the individual's home and drop off that food for them. There have been organizations, there have been pop-up groups, hey, if you need help, but it's really hard to get that systemically. And what we found is that there are several members of our community who are elderly, who don't necessarily have family, who have been food insecure, and excess boxes we've been able to get to them, but we haven't always known right away. Either people didn't know to ask or didn't feel comfortable asking, and that became an issue, especially in the beginning months of COVID. A piece of legislation that I was very involved with on the federal level had to do with communication access in a hospital. So when they were restricting individuals from going into a hospital with a loved one who needed care, part of the federal legislation, the CARES Act, included a tinier bill that we had been working on for years that involved allowing a family member to go into, one family member to go into the hospital with the individual if they had a communication disability or a cognitive disability. So if their family member was the person who they could communicate with either through sign language or who they just felt more comfortable with or who could explain things on a level that the individual would respond to best, that these were not tasks that nurses in the hospital could really take over. Like, they need to be there to do the medical work. And while they tried very hard to be everything to this patient, especially in a COVID ward, they really needed someone to be there with them. And so we fought very hard to allow for the family caregiver to be allowed to be in there with them. There was also some talk around the production of N95 masks that are clear so that you can see the person's face. And there have been many different accommodations that have been made for that. Unfortunately, while there are masks that are now on the market that are clear, none of them have yet achieved the N95 status. So it is a communication barrier for our folks who are deaf, especially and hard of hearing. And many of our elderly fall into that too. And it can be life altering. So we did have that small win where we did get it so that family members could go in. But certainly it didn't cover rehab centers. It did not cover nursing facilities for other reasons. And we have a long way to go with that. It doesn't cover all DSPs, just personal care attendants. Speaking of personal attendant services, the next thing on here is personal assistant services. One situation that we ran into a few months ago was a family whose elderly parents both used home care services in another state than they were in. And due to the fear of COVID and a lack of ability to get a hold of PPE, the elderly couple gave up their personal care attendants. And in one case, the nursing staff were not showing just because they were afraid that there were no COVID tests being brought into the home. So they didn't trust that the couple was free of COVID. That meant that people were left in their beds for days on end until family out of town figured that out and were thankfully able to travel and go there. And we worked with the local Chabad, and we worked with the local what is there associated, so the Federation and Jewish Services, which they had not been connected with in the past. They had secular services consistently in the past for this particular family. And we were able to get emergency personal assistance services in over a long weekend, a holiday weekend. And then by the next week, we were able to set up additional services. In between that, they were able to get a home test shipped for COVID to the house. And one of the two ended up testing positive for COVID and had to go to the hospital a couple days later. So all of those pieces we had to bring into that situation because it was not a seamless system. Talked a little bit about home and community-based services for folks who are caught in a congregate setting during COVID, had not had plans to move into the community, but were scared of staying in the facility because they were scared to get COVID, or whose families were scared of that. In Maryland, as in many other states, money follows the person waivers are available. And if the state asks, if the governor asks the feds to use their emergency COVID money for housing, we were able to get a few people situated in such a way that they could go into a hotel with attendant care that they trusted, that they knew from the facility already, that were all COVID negative, and stay there for a certain amount of time as a bubble. What Maryland does not have that several other states do have is the ability to deem someone who lives in a nursing facility to be homeless. In other words, they don't own that home, they don't rent that home. It's a room and board situation instead. In other states where that designation is different, FEMA emergency sheltering money for the homeless can be used to rehouse and pay for attendant care for these individuals. And so in other states, we were more able to do this than we were in Maryland. We did get a few, but not as many as we could have. So within the Jewish community, some of the systemic changes that this COVID pandemic has given us, and I kind of want to stress this, is I'm talking a lot about the difficulties and the negatives of COVID on the community. But there have been incredible opportunities as well. And that is, many of us have been, like, I'll just use myself as an example. There have been plenty of times where I have wanted to participate in a shir pre-COVID, and I've asked someone to put me on speakerphone in the room, and either they forget to charge their phone, or they're in a noisy place that I can't hear everything, or they put it on the table and the papers are rummaging, and so it's not so effective. But now video conferencing is used everywhere. It's one of these things that we don't have to change that back when we open up again, is that for those of us who haven't been able to participate, either due to low immune systems, during cold and flu season, if it's fatigue, if it's chronic pain, whatever it might be, or just an inability transportation-wise to get there, that shiurim can be made much more accessible. Accessible minyanim, I've been very fortunate, depending on the time of day, of course, but my home shul in St. Louis has always, through the pandemic, been able to do daily minyanim over Zoom. So they have a socially distanced outdoor minyan, and they've even started inside in a much bigger space now. They bring 10 in, and that's it. Well, 10 for the men's side, they do have on the women's as well. And then they set up a Zoom. So for daily minyanim, I've been able to participate almost every day. Shabbos is still an issue, but it has meant that I've still had community. The other thing is the role of chesed committees. And many of you have heard me speak about this before. It's the ability to respond to a person's actual need. So when someone comes forward and says, hey, do you have a number for X? Do you have a resource for Y? COVID has made it easier for a lot of us to say, hey, we're needing some help with something. And it's made it that much easier, I think, for people to be hearing what people are saying, instead of, oh yeah, this person mentioned last week that they were having issues with X. Instead, it becomes more of, wow, I've heard a couple of people talk about this. Maybe we should get together and figure out what we can do to alleviate this need. So these opportunities are available in our communities, and I think we're at a time and a place in the Jewish community where we're much more open to hearing it and seeing it. And yeah, this last slide is just how you get in touch with us. There's a lot of interesting things on there. We have to update it. It's a little bit out of date. But I will let Rabbi Kaplowitz take, I guess I need to give you the host back at this point, and I can do a Q&A. We can talk about some of these issues a little bit more in depth, however you want to do that. So I'm gonna go ahead and make you the host. And you should have that now.
It was so nice to just be an audience member on one of these things. Thank you, Sheryl.
Yashikov, Sheryl. Thank you so much.
Sheryl, fantastic.
So I'll get the ball rolling, and then as other people have questions, please feel free to either raise your hand in the Zoom feature or put something in the chat or somehow let me know. The question that I want to start with is, I'm amazed, Sheryl, to hear about all the work that you're doing, and it's a little, for me, confusing to keep track of kind of what's the Jewish component, meaning obviously this is all important articulation and embodiment of Jewish values, but as the Jewish community, what specifically is the Jewish community doing? What should we be focused on from that lens, and what is kind of in the more national, broader scheme of things? How do you balance that?
Sure. It's a great question. So I did mix it deliberately because I was sharing from our experience within Yad, and we specifically serve the Orthodox Jewish community. We will serve others, but that's who we're set up to serve. So all of these issues are Jewish issues in and of themselves, right? As Jews, we value people's lives. We put above all other things, including the ability to break Shabbos if there's someone's life at stake. And so these medical rationing questions and the communication issues, getting relevant life-saving information to people, like people have a weather radio that they leave on, right? If someone's deaf, they don't have access to that. So we need to make sure that in our communities, the people around us have access to life-saving and life-sustaining information, access to appropriate healthcare, and things like that. So that's where like the Jewish overall general values come in. In terms of Jewish community, it's understanding, a lot of it is about understanding how the Orthodox Jewish community is structured. So for example, with food security, so much of that in this Baltimore Jewish community especially was centered around the Jewish day schools and the kids getting lunches at the schools. But those were pre-packed, so someone who has a dietary need that can't be met by a pre-packed system like that, they couldn't use that food. Someone who didn't have kids didn't know where to go to because the Jewish community was promoting for the longest time that this is available through the schools. And we connected, I can't tell you how many people we connected through Baltimore County and Baltimore City in terms of the produce boxes and how we might get people dairy and meat that in those county boxes, at least, it did not start out being kosher products. And so we were able to get people gift cards and things that they could use at grocery stores. For people who really can't use online systems for shopping, having a volunteer able to help shop for them, things like that. So as a Jewish community, it's helpful for us to realize how our communities are set up. We're very family centric, and so much revolves around our kids that we need to make sure that when we do that, it's flexible enough to meet the needs of everybody. The IEPs is another issue. So the Jewish day schools have struggled for years and years, this is all over the country, because many of them don't take federal funds. There's always a push and pull as to whether they follow the Individuals with Disabilities Education Act or not, or just 504 plans, which are not as solid, and how they get, if they do school vouchers, for example, how they get money from the local school districts in order to serve their kids in the best way possible. As a Jewish community, we lose a lot of our Orthodox Jewish kids with disabilities to the public school system for the simple reason that the day schools are not quite there yet, and Baltimore has had this issue. But when it comes to IEPs and virtual learning, all of a sudden, a system that wasn't being followed in a wonderful way had additional strains on it. And many of our kids who were making it, quote unquote, in the Jewish day schools, but really needed additional supports that they already were stretched to get, really had a lot of difficulty over the last year. And we've been trying desperately to help some of these families to get additional non-virtual spaces that are socially distant and appropriate. And unfortunately, for many of our kids with disabilities, it comes along with additional immune system issues. So, the going away from the virtual space into a socially distant physical space is also not always the answer because it can't always happen. So that's been particularly difficult. And I think that it's a space that we need to really watch in the coming years because those kids who have lost a year or more of school, a lot of our kids with disabilities were already marginalized and behind to begin with and struggling to begin with. And they're our future. We can't afford to lose our kids with disabilities to these circumstances. So I think we have an opportunity as a Jewish community to really focus on how we help these kids to catch up. So
Thank you. It looks, Moshe, you have a question or comment?
Yes, yes. I know that the state of Maryland has included residents of group homes and people with cognitive disabilities in groups approved to get the vaccine. Now, I also, I think that the state of Maryland has really not extended that a little more broadly to all disabled people, as I've been reading in the papers. So now, and of course, extending, putting people into an approved group doesn't mean they're going to get a vaccine, get an appointment to get the vaccine, or if they do, be able to get in and actually get the vaccine. So that's what I'm asking. How is that working out as far as vaccine accessibility?
this is Sheryl. So thank you so much for the question. I'm realizing this is a recorded call, so I'm going to be really careful on how I say this. Maryland is doing not such a great job with this. We are towards the bottom of the states in how we have done this. Part of it was an oversight, and part of it, as always, is for specific reasons that happen to omit the needs of people with disabilities. So a generalized statement is that Maryland chose to decentralize their system from the beginning. They delegated to the counties. They were having difficulty getting what they needed from the federal government when everything started. And so they passed that to the counties and said, go ahead and do it. Now, the biggest problem is that each state was required to file a plan with the federal government back in October. And they did that, and they did that in order to get their initial allocation. And they went based on population and the priority groups that the CDC put out. And then each state within that plan did their own prioritization. And Maryland's did not follow that CDC guideline, and that CDC guideline has also changed, but it didn't follow it to begin with. And then when they turned and delegated it to the counties, they didn't require them to follow either the CDC nor the state. So what ended up happening is each county did their own thing. Some counties are prioritizing people with disabilities of various different iterations, and some are not. There is no single pre-registration form for these slots. There is no single phase, right? People with the same condition, depending on where they live, are in different phases. And so you're right, it got very much messed up, and 100% of my paid work right now is helping the state understand how to take that control back, how to centralize it before they get hit with a lot of civil rights violations. And while we can file complaints all the time, these folks with disabilities are at higher risk of death from COVID by about 40%, give or take the different study that you use. And so while we mess around with filing complaints, people are dying. And so we are having meetings constantly on changing these things. We've seen a little bit of movement. I can tell you, I just had a meeting with the head of Hopkins Emergency Medicine today, and that's who they've put in charge of the COVID response at Hopkins. I had assumed it was going to be a critical incident, but it turns out to be this gentleman. And it was a fantastic meeting, and he really does get the issues. Part of this is that the governor also gave control to 40 different hospital systems, medical systems, I should say, and they're using the CDC guidelines. So they're not using the priority groups 1A, 1B, 1C, et cetera. Currently, just so that folks are aware, and this again changes, but 1A, group 1A included nursing facility residents, but it did not include like long-term care. It did not include rehab facilities, those kinds of things. So even within the prioritizations, there there are populations that were missed. The governor has said that very publicly in press conferences that everybody who wanted a vaccine has gotten it from this phase and we've moved on. Unfortunately, on the ground, what we're finding is that they weren't asking people who had guardians in every case if it was okay to give them a vaccine. And if they didn't have that consent, if they didn't ask that or get a response back, they marked the person as not ready at this time or not interested at this time and moved on. Also, if there was active COVID in a facility at the time that they were ready to vaccinate, they moved on to a different facility because they couldn't go in if they had active cases. So that data is skewed to begin with. Phase 1B in Maryland at the state level, not the county level, but the state level, does include group homes. It does include incarcerated folk. It includes people with intellectual and developmental disabilities, which in Maryland is below the age of 22. So if you have a car accident at 17 and have a spinal cord injury, you can be covered under that, whereas that same individual getting that same injury at age 24 would not be able to get it. So there are inequities with this. Also, people with other types of disabilities that do not technically fall in that intellectual and developmental disability phase were not classified as able to do any of this at this point. They were put in phase 2. There was a lot of backlash from the disability community. And as a result of that, they created a phase 1C that included people with certain immunocompromised conditions and comorbidities. And for that, what they did was they looked at the CDC guidelines and they pulled 6 different conditions out of that list, which is not, it seemed random. There are many more conditions on that list. They chose 6, but then they told the hospital system, hospitals, you take care of those folks. So if you look on the county websites, many of them you will not see a question that talks about COPD or diabetes or people with sickle cell or solid organ transplant patients, people who are taking chemotherapy. Those are like those conditions. You don't see questions about that. What you do see is in some cases, intellectual and developmental disability. So while we're working through making them standardize this process, the best thing to do if you've got someone who needs that vaccine, believes that they should be prioritized based on that disability type or immune system, whatever that vulnerability might be, contact us at the Centers for Independent Living. You can contact me. If it's not the right county, I can connect you with people who are doing it in other counties. Right now, my work is centered on Baltimore County and Baltimore City and a little bit of Harford County. But I can get you in touch with, we've got someone in Montgomery, we've got someone in Anne Arundel, and Howard County. So we can get you where you need to go. It is a big problem. We are working on it. It is the biggest worry for us at this point, besides the medical rationing during a surge. So I hope that helped. Sorry, it's long-winded, but great question.
Well, the other part of the question is, okay, even if people get prioritized, will they be, I mean, so many people who are prioritized now can't get the vaccine.
Right, and part of that is due to the way that they allocated it. And I do believe that this will eventually even out. We are about to get 1, possibly 2 more products. So that should also help. One thing that this does bring up though, and I do want to mention this since you've now mentioned it twice, the pat answer that we get is, oh, there's limited supply. And we know that people with disabilities do understand this. And we're not asking to jump the line. What we're asking for is equal access to the line. It's like saying to someone using a power wheelchair, you can come an hour early to shop so that you don't get run over, people don't run over you. And the person using the chair gets there and there's a flight of stairs. So no matter how early they get there, they can't get in that line. And that's what we're really seeing right now with these decentralized systems, is that we're all being told that we're eligible. And in one sense, there is vaccine in certain of these pockets if you can match it up correctly, but there's no way to get from here to there. There's no connection. And so we are working on it. I do believe that by May, June, things will look different and will look better. And it hurts me to say that because every day that it's not a working system for our folks, more people are more at risk than the general population. And we will lose people because of this system.
Any other questions or reactions to what Cheryl's been talking about?
So this is Rich Zorowitz. I'm on this because Sheryl, I don't know you very well because I left a few years ago from here. I'm down in Montgomery County, but I'm a physical medicine rehab physician. I take care of a lot, and actually part of what I do too is I'm medical director of a brain injury rehab organization called REMED. We have two group homes, actually one in Silver Spring, one in Columbia. I totally agree. I mean, our residents are finally getting around to getting their vaccines because they are in group homes. But I still have a number of, my adult CPers. I've one who just emailed me in Virginia, in Northern Virginia, unfortunately, who's basically said, how do I get online for this? Because I can't really do this. And I'm like, I can write you the letters, I can do all that stuff and help you out, but that's as far as I can, that's probably as far as I can go with that.
Let's connect offline on that because, yeah, we can certainly work on that. And if the person in Virginia actually works, even teleworks in Maryland, I can help with that too.
Okay.
And I do have a question. Do you have were you able as a provider to contract with the state?
Well, I'm part of MedStar actually, initially, and I'm actually at, my day job really is at National Rehab. So I'm actually in DC.
Okay.
So I don't, so I'm not on the Maryland side of MedStar to know how they worked all that out.
I can help you with that. And it's actually one of the brighter spots in Maryland. So let's talk offline.
Okay, no, absolutely. Thank you.
Moshe.
See, there are two problems. One is having enough vaccine, and the other is access for people who have a hard time accessing. It seems to me that would really be good to have a mobile vaccinating team.
Yep, we're working on it. So again, this is Sheryl. Since each county's health department has control of that, we've had to approach them separately. There are some major medical systems that are working on it as well. MedStar will eventually, in Maryland, MedStar will have a mobile van. And I believe that there's one other medical system somewhere south in Maryland that's going to be doing that eventually. Those systems are not set up yet. We're working on it. Part of this is that the governor has switched where the allocation of vaccine is allowed to go. And so they can't really say, hey, we're going to do a mobile vaccination clinic and we're going to do a pop-up over here. We're going to do a van over here to get this community that doesn't have transportation and can't get on, those things. They can't really do that unless they know that when they've been told they're getting 200 vaccinations for a particular week, that they're going to get it. I made up those numbers, but several of the entities haven't actually received what they believe that they were promised. And this is getting down to the county level. We heard this a few weeks ago nationally, but it's actually happening at the local level as well. So we are very well aware of it. It is something that a lot of entities really want to do. And in fact, I was in a meeting about it for Baltimore City today. So we are working on that. The other piece of this is standing up a call center for those folk who do not have access to the internet, don't use computers well, don't have good English proficiency, who just, no matter what, don't have the family or the friends who can help them sit on websites all day, every day. And that call center, so what's happening in Maryland now is they're giving phone numbers for the county's Department of Aging, what they call the Maryland Access Point, which was a hotline that was already there before COVID to serve as an information line for the elderly. They're not set up to do this. They're not set up to handle this. 211, 311, if you contact them as a person with a disability needing help to fill out forms, they don't have time to do that. They're answering the next call. And so what we have asked for is one centralized call center, which FEMA will reimburse the state for, by the way. We've done it many times, like Hurricane Harvey, for example. They stood that up in 24 hours. So if the state asks for it, they can get it. It's about getting the decision makers to do it.
And did I see a hand?
Thank you. Yeah. Tomorrow, I'm going to be speaking with someone who has a 100-year-old aunt who is confined to her bed, who lives in, I'm not sure if it is Silver Spring or if it is in a Maryland County. I'm not sure. I have to find that out. But she has attempted to get, she is the closest, physically closest relative to this person. She herself has a very, very difficult disease, a rare spinal sort of a thing. So it's not easy for her to just pop down there and do things. But there is another niece, but she's in a different state. So I was planning to follow up tomorrow to find out, you know, what's happening there. Would it be possible for, I don't know if you give out telephone numbers at this point or whatever, but I really would want to know if it would be possible if she could call you and ask you for help.
Yeah, this is Sheryl. Rabbi, I'm going to ask you for a couple of things. If you can capture things in the chat and email that to me, because I think I've seen flashes, so I think people are maybe trying to contact me that way. The other thing is if you would give my contact information to anyone on this call who's interested, you know how to reach me. So that might be the easiest way to do that. So I would be happy to. There is someone who is doing this work in Montgomery County. She's a good friend of mine, not in the Jewish community, but I can connect her with the right resources. So we'll work together on it. That's Montgomery County, Silver Spring. So we can do that.
Oh, thank you so much.
All right, we're coming to the end of our time. Are there any final questions or thoughts? If not, I will encourage everybody in continuing with the Jewish Awareness of Disabilities Month this coming Sunday evening. The Chovevei Torah series that we've been a part of will be having a wonderful, it sounds like a wonderful session. It's called An English Language Megillah, A Story of Halachic Accommodation, discussing, just I can imagine from who's speaking, making Kriyat HaMegillah, Megillat Esther, accessible for those with learning issues and Asperger's syndrome and the like. That's their information to register, and to get the link for that is on the Sheryl website, or you can go straight to the Chovevei Torah website. Lighter side of things, Sunday morning will be our group Humintashen Bake. Everyone is welcome to join us to kibitz and fill Humintashen together virtually online. Next Tuesday evening, in this time slot, will be our discussion of topics of Purim, relating to Purim and Zoom and Erev Shabbos and all the complications of Purim this year. Sheryl, this was wonderful. Thank you so much for continuing to be a voice of strong advocacy and continuing to educate us and pushing us to do better and to really think about issues that, as you said, sometimes we need a gentle or not so gentle reminder about. So this was wonderful. Thank you. It's great to see everybody. This was recorded. The recording will be posted on the YouTube channel. If anyone needs to get in touch with Sheryl, please feel free to let me know and I can make that connection. Lila Tov, everybody. Thank you.
Lila Tov.
Thank you, everyone.
Bye-bye.
Thank you. Good Shabbos.
Lila Tov.